Thank you all for coming tonight. I think we have too many people watching a basketball game. Anyway, we're happy that you're here. My name's Mary White. I'm sort of taking over for June Gerard. Just a couple of things I want to mention. First of all, Barb Francis is at the back. Anyone here who is not a member of the League and is interested in joining, she has these lovely brochures that tell you about the League of Women Voters, which is for men as well as women, and so we hope you'll think about that. And the other thing I want to mention is that Mary Kilgore and Alice Gridley are outside asking people to sign a petition, and let me just read a couple of sentences about this petition. Okay. This amendment would grant all Floridians a fundamental right to clean and healthy waters. The key word is fundamental. This fundamental right would take the precedence over the permitted rights of polluters and enable us to hold the state accountable when it permits the degradation of our waters. And the petition you're signing is to get it on the ballot. So even if you favor dirty water, you could still sign the petition. Okay. I'm going to turn things over now to Henry Logan, who will introduce our speaker.
Thank you, Mary. And thank you for giving me the opportunity to introduce our speaker tonight. It's really not necessary that I tell you that he was the Dean of the College of Dentistry or that he was the President of the American Dental Education Association. It isn't even necessary that I tell you that he collaborated with one of our other residents here, Linda Summerfield, on some very important NIH-funded research. But it is important for me to tell you that Frank Catalanato hired me to the University of Florida. And I was reluctant at first, but it, as you've heard me say, was the best career move I could possibly have made. Frank has been a remarkable leader in the world of dentistry and has had a passion for access to dental care that seconds none. He has been aware as a pediatric dentist of the challenges that kids face if they don't have good oral health and if their face is disfigured. But some of the most exciting work that Frank has done from my perspective is that he has worked with the concept of a dental therapist and was very, very much involved with that program in Alaska and did a lot to help give access to Alaskan kids who are from the most remote parts to have good oral health because they had access to that through dental therapists. Here in the state of Florida, as you notice from the title slide, he calls himself a part of the National Coalition of Dentists for Health Equity. I hadn't seen that title before, but that certainly encapsulates his passion and his desire to make dental care accessible to kids, but also to older seniors. As we all know, we are an integrated unit as a human being, and if we don't have good oral health, it's very hard to have good overall health. So with that, I turn it over to Frank, and I want you to know you're in for an exciting story about how he gets legislation on the forefront for people who don't really understand the importance of oral health. So Frank,
thank you very much, Henry. Thank you very much. So normally I stand with a microphone and pace back and forth as I do these presentations, but it's the end of a long day with a variety of meetings, and I have two artificial hips, and sometimes they don't help me move around as much as I would like. So thank you very much for the introduction, Henry, and it's a really pleasure for me to be here. What I'm going to do is speak for about 30 minutes. The slides will be available if anyone is interested in the material that I'm not going to address toward the end of the presentation. But I wanted to focus mostly on the reasons why we're doing this, why I'm making this effort along with many others. This is the usual disclaimer that I have to provide to any talks that I give, especially in Florida. The key one is the second from the bottom, that I'm speaking on my own viewpoint, and even though I'm still working at the University of Florida College of Dentistry, my remarks do not depict the official positions of the university, especially about these issues that we're going to raise a little later on. And as Henry said, she stole my thunder. I'm the smart guy who hired both Henrietta and Nelson. How many years ago? I don't remember how far back it was, Henry, and we had a great time together doing lots of good things for the dental school and for dental students at the University of Florida. So we're going to talk about a couple of things. The one that probably most important to you personally is the first part of this presentation, because we're going to talk about why oral health is so important. And it's way more than a pretty smile. It's way more than a fresh breath. And I actually spoke this afternoon to the Alachua County Legislative Delegation, and that's how I opened my remarks. Access to dental care is not about a pretty smile. We're going to briefly mention this issue of oral health inequities and why I use the term inequities rather than disparities. We're going to spend a fair amount of time on how bad things are in Florida. We rank near the bottom of the country in measures of oral health and measures of access to oral health care. And then a little bit about some of the solutions, and then what could you do as help to help this situation as individuals. So we now know that a healthy set of teeth, good gums, clean gums, is not inherently important for its own sake. What we now know, the science, the literature is unequivocally clear about how healthy teeth and healthy gums affect the rest of your life. And here's the tragedy of this story. Insurance companies that maintain both a medical and dental line of insurance have known this for over 30 years. They've kept it secret as a trade secret to make their companies more competitive. And it was only when some academic folks started writing about this that they were forced to release a treasure trove of literature that documents the things I'm going to tell you in the next few minutes. And so people who have oral health inequities, who have poor oral health, they carry these problems on to the rest of their life. Here's the one that's probably most relevant to you as a group of seniors, and that is the relationship between poor gum disease, poor periodontal disease in my language, gum disease in the language, and in particular diabetes. The literature now is unequivocal about the relationship with diabetes. People with gum disease have difficulty managing their diabetes, and that has bad health consequences for them, and it has bad economic consequences for us as a country. All right? So this is really serious. Now, a couple of other diseases, the scientists are not yet willing to say there's a causal relationship. What is clear is that there's an associated relationship, that people with poor oral health, poor gum health, have problems with cardiovascular disease, that moms who are pregnant have preterm babies that are low birth weight, and there's economic and health consequences for that. So if you got a dental appointment tomorrow, as I heard someone did in the audience, keep it. And if you haven't had a dental appointment, get one. It's important for your health, and it's important for your well-being, particularly if you have diabetes. Here's another really great study, just a couple of years old, out of Blue Cross Blue Shield, which again has both medical and dental lines of insurance. And I want you to just look at the highlights is all I can try to give you in this short period of time. Members with these conditions have nearly 2 fewer years of healthy life because of bad teeth, bad gums. This is the most fascinating new study. This was done in New York State. It was done with patients who are enrolled in the Medicaid system in New York State. So these are vulnerable, poor patients where fortunately the investigators were get a hold of both the medical expenditures and the dental expenditures for Medicaid in these patients. And a lot of gobbledygook on that slide. The bottom line was, for those patients who had high expenditures for getting preventive dental care, they had lower medical costs. That means they were healthier. So this is the most definitive, really good recent study. And what we're hoping to do is a similar analysis here in Florida in the next year or two, to document, see if we can document the same kind of thing. Because legislators, while they may like this kind of data, their first question is, do you have similar data for Florida? And so that's our job, and that's what we've been focusing on for the last year or two, is to get the right data for our own state. So what's the way out of poverty for a poor child who grows up in a poor family? The way out of poverty is education. With education, that's the difference between a job in a good firm with benefits or the job at an hourly rate at Walmart. All right. Unfortunately, we now have the critical review paper I reviewed just the other day. We've shared it with a newspaper reporter who's going to do an article on this. Over 1,500 studies which clearly document the relationship. In children now, it's not gum disease, it's cavities. The relationship between cavities and school absenteeism and actual poor performance in school. Those kids are not going to learn well. We did a survey a number of years ago of children in Gadsden County. One of our graduates was the dental public health director in that county. We examined every school child in the school system. 1 in 5 children was in pain. Not that they had a cavity, they were in pain. How are you going to learn if you're going to school in pain? You can't focus, you can't concentrate. So let me briefly, with that introduction, talk a little bit about this issue of inequity. So my friends who are more knowledgeable about these kinds of issues have discouraged us from using the term disparities. Because disparities simply means that some people have it and some people don't. And the term inequity actually refers to the fact that there's something not random about them not getting, in this case, dental services. People in poverty have less dental services than people who have money. Racial and ethnic minority groups have less dental care and less access to dental care, and therefore poor oral health. It's part of the system. It's built into the system. So that's why we use the term, it's an inequity rather than a disparity. And there's lots of talk about this, but we haven't seen any real action from my perspective until the movement of the implementation of what Henry called dental therapists, and I'm going to talk more about them, a new healthcare worker on the dental team that can help address, in particular, low-income, rural, and underserved populations. And so I'm not going to bore you with data, but all the data we can get shows that there are these inequities for racial and ethnic minority groups. There are inequities for very young children, for seniors, and in particular for seniors on low income. Okay? Again, I'm not going to go through the details of that, but just to give you that picture. Medicare beneficiaries. I'm presuming everyone here is on Medicare. How many of you had dental insurance when you were younger and working and went to Medicare and found out there was no benefit. There is basically no dental benefit in Medicare. All right? And the result of that is high out-of-pocket expenses, and people don't seek medical care. But I've told you earlier that if you don't, and you have gum disease, you're going to suffer other consequences. So, and for years, we have been trying, we and a number of other organizations, trying to get a dental benefit in Medicare. It fails because, quite frankly, it is opposed by the American Dental Association, and they have one of the most powerful PACs in Washington. This is a political issue. Now, the good news is CMS, the federal organization that regulates Medicare, just issued a proposed new regulation that is going to start to cover what they call medically necessary dental care under Medicare. And this is very exciting for advocates like me. Even though I'm a pediatric dentist, I'm also a senior citizen now. So I care about this myself. We're waiting to see what those rules are going to look like in the next couple of months. A lot of effort going on, though, to convince them to make this as broad a definition as they can. And you saw by the science earlier, when you're looking about diabetes, it should be pretty broad, because a large number of the population have diabetes. A large percent of the population have cardiovascular disease. So what I like to say is our dental care system works in this country if you're middle class and above, if you can afford to get access to dental care. But for the rest of the folks in this country, it's broken. And the good news is that I'm not alone in feeling that way. This is a commentary written by the head of the American Dental Association Health Policy Institute. They give him lots of leeway to say what he wants to say, and he says what the data says. And his own conclusion is the system is broken in our country for a large proportion of the population. And so our estimates are that we're talking about 190 million people in the United States that don't get access to regular dental care for a variety of reasons. Florida is the worst state in the country. This is people living in what is designated as a dental health professional shortage area. It can be a county, it can be a zip code, it can be a location somewhere in the state where the dentist population ratio is not strong enough to support people getting access to dental care. We rank worst in the country with over 6 million people living in these areas. This looks at another factor. This looks at children. So this is something we call Medicaid utilization. So of all the children living in a state that are on Medicaid, what percentage of them had a dental visit last year? Florida ranks 5th from the bottom. We're getting our updated numbers. I'm so excited. We're getting our updated numbers in about a week or two. But the indication is that we've dropped one place. We're down to 4th. And in some measures, we're down to 2nd from the bottom in the country. The national average isn't too good, 52% on that slide. But in a state as big as Florida, with as many kids as we have on Medicaid, that means 1.4 million kids did not have a dental visit last year. And you saw the consequences of that I mentioned earlier. And this just 1.4 million kids without dental care. And all healthcare providers, including not just the American Dental Association, but the American Academy of Pediatrics. Pediatricians now deliver preventive dental services in every state in the country. And I helped bring that to Florida over 15 years ago. And I trained a number of pediatricians' offices. It's now standard part of pediatrician residency education to deliver preventive dental services because these folks see kids on Medicaid. And most dentists do not. So I'm not going to go over that. Here's another interesting one. This is a slide depicting the percentage of children who have unfilled cavities in their mouth. So as a state, you can see we're about 6 from the bottom, about 25% of our kids in Florida, compared to other states, the 6th highest in the country. But what I want you to look here is Alachua County. Alachua County, if it were a state, would have the 2nd highest percentage of children with unfilled cavities. That's tragic. Right here, this county, a relatively well-off county. This is the number that I hope grabs you the most. When people can't afford to go to a dentist and they're in pain, they go to a hospital emergency room because the hospitals are required by law to see them. Okay? 2019, Florida led the nation with 150,000 visits to a hospital for a dental problem. Well, what happens in the hospital, emergency department, these are physicians, they don't know how to take care of these dental problems. They give them antibiotics and pain medication, and they're told to go see a dentist tomorrow. Well, if they couldn't afford to see a dentist today, what makes you think they're going to be able to afford to see a dentist tomorrow? And 4,000 of these people had a dental infection that was so serious, they had to admit the child or the adult to the hospital. It was life-threatening. That's bad enough, but when you consider that hospitals billed out over $630 million in 2019 for this wasted money, because nothing happens there except antibiotics and pain medication. And some of the new data that I've already received shows that one of the causes of these expenditures is that Florida also leads the nation in what we call frequent flyers. People who go to the emergency room 4 times or more in 1 year for the same problem. We lead the country in frequent flyers. And our costs, I can't tell you the cost yet because I haven't gotten to that part of the analysis. Again, I'm expecting some of this new data in about a week or 2. This is tragic. This is all wasted money. I could put that money to preventive dental care across the state. And this was just a summary of some of the specific data for children. It's the same sad data. Again, if you're really interested in this, Henry's got the slides, and you can look at them to look at the details. Again, we unfortunately rank worst in the country. This was a mention, what I said a few minutes ago about Medicare is thinking about supporting medically necessary dental care for Medicare recipients. So why is this? Why don't people go to the dentist? What's the problem? The biggest issue is costs. Okay? There's no doubt about it. Every survey, including surveys from the American, people can't afford it. Even middle-class people are having difficulty. And we saw this in the erosion of visits to dental care that was pre-COVID. And then the second issue is poor oral health literacy. People don't know it's important. Oh, those are just baby teeth. They're going to fall out. Oh, I've, soft teeth run in my family. Get some teeth taken out for gum disease. I don't need those teeth. Not true. It has major effects, negative effects on your health, on your productivity. Just again, looking at some new data, lost school hours, lost work hours, enormous numbers. So there's lots of solutions that we can take and address these problems. We can try and improve the oral health literacy of the public and in particular policymakers. But that's tough to do. It's tough to impact and change people's behavior. All right? We can do something we call medical-dental integration, bringing medical care and dental care together. So last year I ran a pilot project where we placed a dental hygienist in a pediatrician's office. Boy, did it work outstandingly. We significantly upped the number of kids who got preventive dental care, and then when they needed it, got referred to the dental clinic. Next step would be to do that in private practice, where most of the patients are. This was in a community health center where I could legally do that. It's not legal in Florida. We have one of the most restrictive dental practice acts in the state, in the United States. We could certainly improve Medicaid reimbursement rates. Look, I don't blame many of my dentist colleagues for not wanting to see Medicaid patients. The reimbursements, particularly in our state, are awful. But there's not a one-to-one relationship between improving rates and getting dentists to see Medicaid patients. What we're pushing for is workforce changes. And we have two pieces of legislation that we are working on. We've been working on them for 5 years now, but I'm persistent. And I'll talk more about them in just a couple of minutes. But the two pieces are, we want to be able to allow dental hygienists to provide preventive services to patients, children, adults, in settings where they live and work and go to school. Okay? We need changes in the Florida Dental Practice Act to do that. And then we want to implement dental therapists, which I'll talk about in a minute or so. Okay, so Florida legislators recognize this problem somewhat. 11 years ago, they passed, in 2011, 10 years ago, they passed legislation allowing dental hygienists to provide some limited preventive services in what they call health access settings. And that's been working for 10 years or so. And what we're trying to do is push through legislation this year that would tweak that just a little bit so they can provide services more easily and get reimbursed for those services without the direct supervision of a dentist. And that's our immediate priority this year. The other thing is to implement a dental therapist. So how many here have seen their doctor and sometimes they'll see a physician's assistant? You've heard the term? Okay. Dental therapists are totally analogous to physician's assistants. They've got a limited amount of education. They don't go to dental school. They go to a dental therapy educational program. And they can provide preventive and even restorative services. This is a 100-year-old profession used in 50 countries around the world. Alaska got tired of the services provided by the Indian Health Service about 18 and 19 years ago. And they looked around for what they could do for, as they say, the native tribes, for their people. They saw this program. They sent a group of young men and women down to New Zealand for 2 years to get trained, brought them back to Alaska, and then started their own program. That's when I got involved. I first heard about it at that time. When I went to visit the program, I started reading everything I could about this, and I'm a big fan of bringing this dental professional to the United States. I am not going to review all the literature. You're going to have to take my word for it or look at the rest of the slides at some other time. 100% of the published literature says they are safe, they provide high quality care, and they are cost effective at bringing dental care to underserved populations. Why are they effective? They're very good at what they do. All the literature says that. So when you go to your dentist, or you come to see me, I may be able to do 400 different procedures that I'm licensed to do. Dental therapists only do 70 to 80 procedures. That means they do more than every day and more than every week. What do you think happens when you do more of these procedures? You get better at it. And the literature says their services are of a quality equal to or better than those provided by a dentist for those limited procedures that they do. Simple routine fillings, things like that. Second, when you run a school-based dental program, you've got to send an expensive dentist to that site with portable equipment to provide the services, when I can more cost-effectively send a dental therapist who has a much lower salary, and I can deliver services here at Hammock or in the 19 schools which the dental school provides services at in Alachua County. It works. It's cost-effective. And ultimately, the last bullet, this lowers the cost of delivering care. These dental therapists have fewer debts when they graduate school. They're from the local community, usually. They have lower salaries, so they lower the cost of delivering care. So this gets into the data, and I'm going to stop at this point in just another minute or two. 100% of the data supports quality, safety, and efficacy. Now, I'm going to be blunt. So 13 states have now adopted this. It's been a struggle, but the swing is going in our direction. We've been working, we formed our coalition in Floridians for Dental Access 5 years ago. You may have remember I mentioned earlier the American Dental Association opposed dentistry and Medicare. They have a very powerful PAC. Well, my colleagues at the Florida Dental Association have the same very powerful PAC here in Florida, and a very powerful and effective lobbying team. And so we've been close, but we haven't got our legislation passed. We're sort of retrenching now, thinking about how we move forward with this. This year in particular, we're going to focus on a lot of public education, get the public aware of how serious this problem is and its personal, health, and financial impact on our state. And then we're going to focus on the dental hygiene legislation this year and put off dental therapy for another year. So let me sort of run to the end if I got any closing comments. I should also add, for those of you who are thinking about these kinds of things, so dental therapists have to go to a program that is the same, has the same accrediting body that my dental school has. They have to pass the same licensure examination that the state of Florida gives to dentists. They have to pass the exact same licensing exam, but it's limited to those procedures that they can do. So there's simply no issues about quality and safety of this. Oh, I went on past the last slide. So that's what we're trying to do. I will tell you that I'm very happy that the League of Women Voters has been in our coalition. Our coalition is 65 organizations. It is bipartisan. This is a fascinating issue where you can bring together liberal progressives like me and conservative free market groups like the James Madison Institute in Tallahassee. Okay? They all support this. They support it because they believe that competition is good for the public, and it's good for the quality of care, and it's good for reducing care. I do it because I believe that access to quality health care is a right, a human right, and that everyone deserves to grow up with a healthy body, including a healthy mouth. So the League has been, I've done several sessions with the League explaining our legislation each year, the statewide group. So I appreciate the support of the League of Women Voters. And if you want more information, my contact information is on the slide, or Henry can tell you. Go to our website, but wait about a month or two because we're revising the website right now. So it's kind of a shambles because it's been in disarray for the last year, but we got some money to revise it. And then with that, I'm happy to answer any questions you may have. Nelson. Oh, sorry.
Does the UF Dental School have this program?
No, and the UF Dental School will not have this program until legislation passes, because the Dental Association will harass the poor dean of the dental school if she provides any support for this program. That's why I had to give you the disclaimer in the front of this. I am not reflecting the views of the University of Florida College of Dentistry. I'm reflecting my own personal views. This has nothing to do with my job at the university. But there's a second answer to your question that's really important. I don't want it in the dental school. I want the educational program to be in a state community college.
Can you get closer to the mic?
I want these educational programs to be in the state community colleges, the one in Miami, the one in Pensacola. Why do I want that? Because the kids who go to those programs are going to stay in Miami. They're going to stay in Pensacola. They're going to come from the local the local area. The beauty of Alaska is that some of them are not young. I mean, I've seen people in their program that are in their 30s and 40s going to school. And what they tell you is, no, I'm going back to my community to provide care to my people in my community. So I want this in Miami-Dade. I want this in those kinds of places. I don't want them to have to come to the University of Florida or one of the other big universities. That's a great question. Thank you. Nelson.
13 states have the program, and I know Minnesota is one that has not been as long as Alaska.
Right.
But what's the experience?
So it's another great question. It's difficult to make analogies between Alaska and Florida. We're talking about a state that, if you lay the map, is as big as the United States in terms of how it spreads from east to west. Minnesota is, despite the weather. And the success has been enormous in Minnesota. So there's now about 150 dental therapists in Minnesota. They work for safety net organizations, they work for hospitals, they work in private practice. It allows dentists to see Medicaid patients that they didn't see before, because now Minnesota has the same problems we do in Florida. They have a horrible Medicaid reimbursement rate. But now the dentist can afford to see these patients in his office. The real problem that's now occurring in Minnesota is the safety net organizations are having to compete with private practices, because the same dentists who opposed dental therapy 12 years ago, when they instituted this in Minnesota, now want to hire dental therapists. Well, and the reason is, and I don't mean this disparagingly, they make more money. But that's okay with me, because now they're doing a social good. Now they're seeing Medicaid patients. So it's working out very well in Minnesota. Yeah.
As a former president of the Dental Wives Association back in Illinois, in a former life, I can't tell you how much your presentation disturbs me. We spent a great deal of our time on education. The problem, you're dealing with a problem that exists. The children are having all these problems, as you mentioned. But I don't hear a word about education, about the prevention of this in the first place. One of the worst things that you can mention is Saturday morning cartoons. For any mother who's had to deal with watching children spend hours in front of the television and having the commercial, financial impact of these big corporations go against our children, I would hope that in all of this, and your presentation was wonderful, I really appreciate it, but first and foremost, it seems to me that the disclaimers you're making ought to be preceded by saying, first we need education to teach the children and the parents what is good dental hygiene. What do you expect them to do? Cut out the sugary cereals and all that stuff. If the impact of the Dental Association and all your academics and all these people that you're talking about would start off with that and then say, but we have to deal with this. We're up against a mighty, financial behemoth, these organizations that are making money off our kids and off their poor dental health. If you would preface all this with saying, this comes first, education comes first. When education fails, then we have to step in with your program. I'm sorry to be so negative, but I've spent years going into schools where we would all, the children with, toothpaste and toothbrushes and teach them how to, brush. Where is the American Dental Association of professional dentists doing this? I think this is very important because your education and your prestige and everything would help to add to the education impact of all this.
So, you raised a very important point that I absolutely agree with. I would remind you, when I had proposed solutions, the first solution was oral health literacy. It was education. So we are not ignoring that. That is a very important part of what we do. Second thing, what I didn't tell you is what the dental therapist does during the day. They don't spend the day filling teeth. They spend a fair amount of time educating parents. One of the key parts of their training, which I can tell you a lot of dental students do not get, is training in a technique called motivational interviewing to convince the parents of the importance of paying attention to their children's teeth. So I totally agree with you. We are not ignoring it. Let me tell you a third anecdote. So you talk to dental therapists who live in these communities of 500 people. This is a true story. In the Neverlands of Alaska. I mean, that's how these folks live. They still go back to their communities of 500 people. They go to the grocery store on Saturday morning, and they see Mrs. Jones buying 2 boxes of sweetened sugar cereal. They say something. They are right there in the community, living with their families and their friends and their neighbors. So I appreciate your concern and your question. Believe me, we are not ignoring education. It is a very important part of what we do. And in particular, my dental hygiene colleagues. I mean, dental hygienists are the experts in education.
I understand why dentists don't want to work with Medicaid. But what is their opposition to these therapists who are going to take care of the people that they don't want to deal with? Fear, competition, fear that they're going to take their patients from their practices and they're going to lose money. This is fear of the unknown. Again, what I told you earlier, in Minnesota, the Dental Association vigorously fought dental therapists. Now those same dentists are trying to hire dental therapists in their offices because they've seen this is not an issue. They were wrong. This is not going to be competition for them. This is going to increase their bottom line. Okay? In Alaska, the American Dental Association sued the early dental therapists to stop this program. A whole bunch of misunderstanding and again, fear of the unknown. Look, we all deal with those issues. Trying something new is difficult, but I have seen enough data to know it's working. It really is working at getting folks to care. Just the way PAs and ARNPs have helped improve the efficiency and cost effectiveness of our medical care system, these are professionals just like them, trained to the same educational standards I have, but only for the procedures that they do. They are safe, they're high quality, and they're cost effective. And they do prevention. And they do education. Yes, ma'am.
Could you say something about the dental care that's available in Gainesville or Alachua County? I know we have about 5 or so free clinics. I'm personally familiar with Helping Hands Clinic, but the only medical care that I know of that's provided is through Acorn Clinic, and that's basically pulling teeth, even from young, homeless, or very, very poor people. I think Gainesville Community Ministries might do something on dental, but it seems to be so far behind the free medical care that's given it needs some attention. Thank you.
Good. So there are actually two what I'll call organized safety net clinics. There's a federally qualified community health center in Alachua County that is over on the east side of town. And then there's the Acorn Clinic. And I'm a past actually board chair and currently board member of the Acorn Clinic. They do more than pull teeth. Take my word, they do comprehensive dental care with very low, very limited fees. But there is a cost to doing that. I mean, someone's got to pay for that. And so what Acorn does is been very successful in getting lots of grants. And they're supporters of our activities to bring dental therapists, because if they could have 1 or 2 dental therapists on their staff, it would significantly expand the amount of care that they have. The real tragedy of access in Alachua County is I believe there are only 2 dentists in private practice that take Medicaid. And then the University of Florida College of Dentistry takes Medicaid, all right, in our pediatric clinic. There is no adult dental benefit in Medicaid in our state. We're one of a lot of states are now moving because they've seen the data that I showed you about hospital emergency rooms. It's very clear now that if you put an adult Medicaid dental program, your hospital emergency room costs will go down. Okay? It's going to be a very difficult issue in our state. I mean, we're not going to get Medicaid expansion. I doubt we're going to get a Medicaid adult dental benefit. But I can show legislators how this can be cost effective. Both the dental hygiene issue that we're doing and then the dental therapy issue.
I'd like to ask a question, Frank. You were talking about the hygienist,
Yep.
the bill that you're introducing in this legislature. What are the provisions of that, and what do you see as the biggest impediments to the passing of that?
Okay. So the biggest issue with this, I wish I'd actually brought my notes. I actually gave a copy of this legislation to the Alachua County Legislative Delegation at 2 o'clock this afternoon. I got an opportunity to speak to them about this. So the biggest thing that we'll do, number one, expand the health access settings where they can provide this care without a dentist's direct supervision. It will allow them to, we use the term, there's a new technical innovation going on in dentistry called minimally invasive dentistry. We have new materials now that we can apply to cavities without using a drill, okay? Without using a drill that will arrest, that will stop the carious lesion in its progress. We want them to be able to do that in health access settings. There's another part of the law that requires that when they see a patient in a health access setting, before the patient can be seen again, the patient has to have another dental exam. Well, for some of these school kids, that's not going to happen. But they are going to see the dental hygienist in 6 months or 9 months. So we're trying to get rid of that restriction. None of this increases the scope of practice of what dental hygienists can do. All these procedures that are in this legislation can be done right now in a private dental practice as long as the dentist is in the office. Again, the literature is unequivocal about the safety of dental hygienists doing these procedures in health access settings. So it's a great question, Henry, and it's not expanding their scope, it's expanding where they can deliver the services they're already delivering in a private dental practice.
And what are the barriers?
Well, the barriers are the Dental Association is calling it an increase in scope, and legislators don't like scope battles, okay? And then the second barrier is just simply we're underfunded to carry on our advocacy efforts. We're very fortunate, both my organization and my new partner organization, American Children's Campaign, both have grants from a national foundation called CareQuest to fund our advocacy work for the next year. But it doesn't compete with the lobbying dollars and the lobbying arm of the Dental Association. But we're talking with them. I mean, literally, God's honest truth, our lobbyists met with them again this morning. and said, well, we're going to go back and try and tweak some of the language to make it more acceptable. But this, you know, politics is a game of dialogue and compromise. And that's what we're trying to do. Now, it'll be a lot tougher when we go to dental therapy next year. But again, I want to follow the model of 13 other states that have successfully done this, and that's what we're trying to do.
Is there any other state that is getting close to passing this?
So the most recent state was Michigan, just last year. I honestly don't know the other states that currently have legislation passing. I can tell you that I know that it's about 4 or 5 of them, but I can't tell you who they are right now. All right? So Connecticut passed legislation 5 years ago for this, but it hasn't been implemented yet. And they're actually trying to, the advocates are going back to the legislature to try and simplify the requirements for the program, because what they passed is just too difficult to actually implement. Maine passed this legislation 6 or 7 years ago and still hasn't implemented it yet. But Michigan is, they passed it last year and they're almost ready to go, because they have such an organized system of advocacy support in Michigan.
Thank you. This has been
thank you very much.
fascinating.
Thank you very much. Appreciate the time.